Don't lie, I saw you doing it like a week ago.
Doesn't mean I finished though.
What the fuck? Hey, can I borrow these pictures? Well, can I own it? There was a bug on your Pop-Tart.
I think if you're 18 now, you want to go on this route? Hey! All right, let's go.
You definitely don't want one. That's why you couldn't read them. It's like if you wouldn't be to your part. Oh, yeah.
What about like the tiger root about it? Everything.
Why?
Tim.
What's going on?
Do you have your bed game? You like other guys are like it's kind of rude, you know? Like
I do it without saying why do you ask? I think people can.
I think
I have a feeling you can.
in the world can have that game.
I'll put it back up later. Just look on school loop. Hey, period 5. Okay, today we're not going to talk about the spine, the pubic column, because we talked about that in chapter 4. And we're not going to talk about the cerebral spinal fluid too much right now. We'll discuss it more later on in the chapter. But today it's really about the spinal cord anatomy, the meninges that make up the spinal cord, and the nerves that come out of the spinal cord. Every nerve that comes out of the spinal cord, except for the cranial nerves, is considered what system? Every nerve, with the exception of cranial nerves that comes out of the spinal cord, is considered peripheral. Yeah. I just thought these were pretty cool pictures of people with really flexible spines. I played a bunch of ping pong this weekend. I couldn't pick the ping pong balls up after about 2 hours. So I don't think I can do that. I did win every ping pong. Okay, the meninges. Meninges is groups of tissue that protect the spinal cord and nourish the spinal cord and have some influence on conduction. They're called the dura mater, the arachnoid matter, and the pia mater. Arachnoid is simply called that because what? Why about it? Why though?
Does it build webs like a spider?
Wasn't that one of the checkpoints? No. it looks like a spider's web. Is what it does underneath the microscope. But we'll discuss these in general, very general. We can go a little bit further into them Thursday. So just write duramatter down. The duramatter is the outer layer of the spinal cord, and it's 99% of its role is protection. The other 1% is maybe nerve transmission, or it is nerve transmission. It's made of tough, dense, irregular connective tissue. In the 8 years we've been dissecting cats at Vacaville High School, we've only ever got one entire spine out.
Is that the challenge?
It is a challenge.
Alright,
We were the first ones.
Chase Loyler did it last year, and then I had a couple other kids get the spinal cord and the brain out, but not together, but it's only been done once. This duramatter, the duramatter is easy to see and easy to distinguish. It's just that getting the spine and brain out of a cat takes dedication. The arachnoid matter is simple.
How many students would be skin crawl?
Yeah.
No,
Not like ours.
not like that. Let's talk about this hour tonight.
I'm kicking your butt in pool, you can tell me how little.
Say back cut?
She didn't say anything about
Look,
it.
Chippy, we don't need to.
That's right. The middle layer of
It's called
the meninges is called the arachnoid layer
Faster.
space, and in between the arachnoid space and the pia matter is where spinal taps are conducted.
What was the middle layer of... What? Middle layer of...
That area between the arachnoid space and the pia matter is called the subarachnoid space. And spinal taps or epidurals give doctors and diagnosticians an amazing tool. Sampling cerebrospinal fluid is a great diagnostic tool, and this is a premium place to inject things like anesthetics, antibiotics, and chemotherapy. When my nephew Noah was born 30 years ago, I was there. My sister had an epidural. And the epidural is a localized anesthetic to allow you to have your baby as pain-free as possible. Now they have very localized and very specific areas they can numb, depending on where they are in this region. They tend... What? Right. This is an old picture. This is where epidurals are normally done for the lower portion of the body. Now they're doing epidurals and anesthetics in other regions of the body, but it's, I don't know if it's being done everywhere.
For example?
Well, they can numb certain parts of your body and then not pull you out. Like for arthroscopic shoulder surgery, arthroscopic knee surgery. Usually that's localized though, it's not going to be done around your spine.
But we're not talking about
baseball guy.
Especially a girl.
So Tim, so you would say you've never been rude to anyone in your entire life? See?
Okay, pia matter. Pia matter is made of collagen. And this is the major, there's no vein, there's not a large vascular artery or vein in these areas. This is where the spinal cord picks up its blood supply. And this matter would appear darker.